Well, all right. We're here with Dr. Limongelli, dentist in Yonkers. Dr. Limongelli, hi.
Hi, how are you, Mr. Flash?
Very, very good. Dr. Limongelli, let me ask you a question. There's lots of patients out there, people like me. We happen to have, missing teeth. 1, 2, maybe 3, whatever, in the back. And sometimes those teeth are missing for quite a while already, a few years, a decade sometimes. And nothing really bad is happening, or at least so we think. Now, in any case, you dentists keep saying, you've got to replace these teeth. And yet, as I said, we have them missing. It's not all that bad. So what's the story? Can you shed some light on it?
Well, missing teeth should be replaced as soon as possible. The reason is that the bite can shift. The teeth in front of the space can drift backwards. The teeth behind the space can drift forward. And the teeth in the opposite arch, underneath or above the missing teeth, can continue to grow upward or downward in attempts to try to fill the space. Unfortunately, the bite is completely distorted over a period of time because of that, and it may even cause a lot of spacing between the front teeth, because all of the teeth start to move.
What do you mean by bite? The bite distorted. What do you mean by that?
Well, when the teeth come together, instead of all the teeth being even, they'll no longer be even. The upper teeth will, if there's a space on the top, try to attempt to close the space by moving into it. And the teeth on the bottom will start to grow upward. So all of the teeth will come out of their normal alignment in attempt to close this space.
I see. So now, having some mechanical engineering background here, looks to me what you're saying is, so for instance, when things teeth come out of alignment, like it's like the hinges, for instance, in your where the mouth, the two arches, keep coming up, down and up. Everything goes out of alignment, and it makes sense that if that happens, you start looking crooked. Maybe you might even get tension in the back neck, and maybe even headaches because of that. Is that what what you guys are talking about? That this type of things it can happen?
Yes, it can lead to that. If most patients that have all of the teeth missing on the top and bottom in the back and are just chewing on their front teeth, can develop joint problems in their temporomandibular joints. And a lot of those patients, when the bite is restored again, when they have more teeth to chew with in the back, the pain tends to go away.
Okay, so that's a good thing.
Yes, it is.
So that's a good thing. So basically, if somebody has missing tooth, things can get out of alignment, and he might experience little tensions, little headaches, and so it's good to check out a dentist if your headaches and your tension don't seem to go away with normal type of treatment.
Very true.
All right. Well, all right. So much for missing teeth. Is there anything else you'd like to add on, or does that pretty much sum it up?
It pretty much sums it up. Other than the options available for replacement of those teeth, there are several.
We're going to talk about them in another interview, in another video. All right?
Okay.
Wonderful. Thanks a lot, Dr. Limongelli.
You're quite welcome. Bye-bye now.